One of the big changes we can expect in the United States as a result of this virus is a big change in the healthcare debate that we never seem to solve. I mean, should the United States go to a fully socialized system like, say, the United Kingdom? They, they haven't used this £1 note for a long time. This is from the 90s. But they have had the National Health Service since, well, I believe since the 1960s. I haven't really looked it up. But it is a fully socialized system. And despite what you hear, it is one of the few in the world that is truly like that. In fact, only Taiwan has a system that is fully socialized and no role whatsoever for private insurance. So their systems like that are somewhat rare, and I'd like to talk about those. But first, I'd like to talk about what we have in the United States because a lot of people like to have a market based system. And that sounds great. I mean, market forces are extremely powerful and they should be used whenever possible. But is that what we have? The short answer is no. And the reason for it is that healthcare is a very special kind of thing. Uh, as much as we would all like to use market forces and have a market set up for things, it's something that has to be done artificially. And in the case of healthcare, it's so difficult because of key market failures. Now, markets often have points of failure that are well known and understood. But in healthcare, well, the four big ones are all hit. Now, these are, first of all, an informational asymmetry. When you go to the doctor, you don't necessarily know what's wrong with you. You're told by an expert, and you have to trust the expert. That gives them an unusual amount of power. There are also times in the market where you have one group that is participating that has a lot more power. In fact, that is by design. We talk about it all the time. A union or something like that, or a state, will negotiate in bulk to try and get the lowest prices possible for their users. Everyone else might have to make up the difference. And so you have a terrible imbalance in the market. There is also a very well defined public good, which we are understanding at a level that we never understood before. I mean, the health of each individual does influence the health of everybody, especially when it comes to infectious diseases. And finally, there are all kinds of externalities that exist in this market. There are, shall we say, free rider problems. And what do you do with people who don't have the ability to pay? So healthcare just doesn't function like a normal market. And with all of these problems, it's very difficult to artificially create one. Now, I was going to try to come up with an example of how to do this, but I simply can't. I don't know how to create a fully market based healthcare system. What do we do? Well, again, countries like the UK are a bit unusual in that they are fully socialized. It's all paid for by the government through the National Health Service. Germany, for example, has a system much more like the Affordable Care Act that we passed in the United States, sometimes known as Obamacare, with a lot of differences. And three of them are very important. The first is that all insurance is, well, paid for by the companies. It is uh, done on a nonprofit basis. The second is a uniform billing and posting of what things cost. If you've ever tried to do things on your own, as I have, you know that the price of an actual service in medication depends a tremendous amount, and there's this negotiating process from hundreds of dollars down to, well, 16 in the case of a medicine I needed. It was just crazy. And the third key difference in Germany is that there is something like a Medicare that's available for people at the very bottom end. That there's a program, a system, so that things aren't just taken care of on an ad hoc basis. What we know through this virus is that in the United States, there are going to be a lot of bankruptcies that result. That's just simply going to happen. And people's contact with the healthcare system is going to be at a level that they have never seen before. We're talking about all the survivors for one. Okay, just think about how this is going to change our attitudes and have us focus on public health as a concept, as something that we need to think about. Can we have a market-like system? Look, it's important to create markets whenever possible, and don't ever think that markets are not created. I can talk about this at length in another time, but markets are always something that is artificial, that is set up. Within one culture where you have one definition of fairness, it might happen spontaneously most of the time. But across cultures, you might have to negotiate. In fact, there's always some level of negotiation that takes place. Markets are great, but it doesn't work in healthcare because there are just too many failures to try and take care of. So, what do we do? Do we simply modify the Affordable Care Act system? That's probably the quickest thing that we can do, and we can get to that level and see how it works. Of course, this means that employers are still stuck with the tab for healthcare. Now, I think that's completely ridiculous, and I can get into, as we talk about ways of working in some more depth, the overhead per employee. It's a strange system. Why should this depend on your employer? Why should they have to foot the bill? There's really no good reason for creating that system, but it's what we have evolved so far. But something like the Affordable Care Act moving even closer to where Germany is might be more palatable than a full national health service. And it's something that we're likely to consider right away, especially when the bankruptcies start mounting. I expect that this will be a big change, but it doesn't really solve the problem, does it? Um, Nobody really wants a truly socialized system. Nobody wants the government to run everything. And in fact, it's going to have to be run at the most local level possible. It's very likely that things will be not run at the federal level, but maybe at the states, with more power given to counties and things like that. After all, it's county hospitals that usually get stuck with a bill for people who don't have insurance in the system we have now. So, exactly what will come down, I don't know, but I think we can expect the debate to change dramatically, and that will only be a good thing. The second aspect of it, though, is in the United States, we have more and more contract workers all the time. How are contract workers being served by insurance? This is a very open question. We have a whole bunch of laws that govern when under the Affordable Care Act. There are things that if you work more than 36 hours a week, your employer has to provide health care benefits. So employers give you 35 hours a week, and they don't give you any sick pay so that you go to work when you have, say, the coronavirus and spread it to everybody. See, healthcare systems are hopelessly tied to employment. And as we change the way we work, we're going to have to change the way we deliver healthcare, or at least the way we think about healthcare. It's going to be important. And the worker rights, especially for those contract workers that have very few, are going to become more and more important all the time. That's something that is simply going to have to be addressed, whether we like it or not. But I think after all of this, there will be a new impetus to really look at the healthcare systems. Should we be socialized? It seems to be working fairly well in the UK, and it works fairly well in Canada and many other countries, but not as many developed nations as you might think have a true single-payer system, and only one has a single-payer system with no insurance, private insurance whatsoever. Okay? So there are examples to choose from. There are ways of looking at this. But as powerful as market forces are, any type of market that we create within healthcare has to be done artificially. Given all of the market failures that take place within a healthcare system, it's going to be difficult, but we can have them in a few places here and there to help regulate the price quality trade-offs that are the real power of a market. Now, in healthcare, everybody wants the highest quality, and yeah, if somebody else is paying the bill, you're certainly going to do that. That's one of the problems with our system right now. So it's not clear exactly how to do it, but slouching into a system even more like Germany, very likely. And we're remarkably close as it is. The rest of the world, well, the developing world is going to have to look at their healthcare systems as well. many of them are going to start breaking down in ways that are just not going to be pretty. I mean, there is a question of excess capacity. Do we have the surge capacity to handle something like this? The short answer is no, and building it out is always expensive. Again, building some resiliency into our systems is very, very important. The easiest way is excess capacity, but that's expensive. Are there any alternatives? It's worth thinking about. I don't have any answers right now. But we know things will change, especially when the bankruptcies mount and people get angry. American politics seems to react to anger rather than plan for a longer term. That's the biggest failing of all. But in the case of healthcare, we might have it. And who knows? The National Health Service might look pretty attractive. How many of these £1 notes does it take if you have to go to the doctor in the UK? Well, you wouldn't use these. They don't use them anymore. But they're still pretty. Anyways, we will see how the healthcare debate goes as this all progresses. But it will heat up. It has to. And there are going to be a lot of people who continue to suffer for years after all of this, after they are better, because they are going to be shackled to debt that they won't be able to pay. And how we handle that is going to become extremely important. All right. Thank you, everybody.